Hello, and thank you for coming to my poster, Examining Mental Health Literacy Support Interventions for Black Christians. My name is Katheryn Roberson Miranda. Just to start us off, Black Americans, despite having lower frequency rates of depression and anxiety, actually report higher chronicity of depression and anxiety. So, that is when people are experiencing mental health difficulties, they tend to have worse symptoms and they tend to not report receiving treatment. This can be due to a number of barriers to care, external barriers such as access and knowledge about mental health resources, but also internal barriers such as higher rates of help seeking stigma and mental health stigma. That is, being worried about being viewed as crazy or weak or having poor moral character or having a hard time reaching out and asking for help. So, what we wanted to do was to understand how video interventions that incorporate the religious identities of Black Christians can improve outcomes, specifically reducing stigma, increasing help seeking, and increasing mental health resource knowledge. To go about this, we reached out to eligible participants through online and community based methods. And people were eligible if they identified as Black, Christian, a New Yorker, and endorsed mild to severe depression or anxiety symptoms. This resulted in 37 participants completing the study to date. Participants were randomly assigned to either the brochure or the video intervention group. The brochure group looked at anxiety and depression brochures, while the video intervention group saw two videos. The first one was a pastor talking about just the different stressors that are facing Black Americans, and then his own experience with mental health difficulties in receiving care. The second video was three women across three generations kind of talking at a kitchen table about their struggles and stressors. And then they discussed the supports that existed within the church. And so participants were randomly assigned to one of these two interventions, the brochure or the video. And then they completed a survey immediately prior, right after, and 1 month later. So for the results, and please note this is an update from the original abstract. What I found was that between the brochure and the video intervention group, there were no significant differences. However, there were differences within the group. So for the people who received the video intervention, those people reported a higher likelihood of seeking help from professionals and higher mental health resource knowledge at the 1 month follow-up. However, they didn't report any changes between the times right before the intervention and right after the intervention for these same variables, and they didn't report any differences in self-stigma across any time points. In contrast, those in the brochure group, so that's the people in blue on the charts, they also didn't report any differences between these three variables from pre-intervention, post-intervention, and 1 month scores. So one of the reasons that we think that there might have been some of this kind of positive change in attitudes for the people in the video group 1 month later is this feeling of relatability and importance of pastoral support. So at the bottom of the results section, you'll see some excerpts from the qualitative findings. So some people said that it was valuable to hear someone of authority talk about their struggle. Other people said that they really liked seeing landmarks that they knew and hearing music that they recognized. And people often highlighted one statement that was said by the pastor of what happens when the comforter needs comforting. And so this really seemed to resonate with people. And it might be that even though there was no significant difference in attitudes or resource knowledge from right before the video to right after, it might have been that like sitting with this and reflecting on the videos help people to kind of have more of that change 1 month later. And so there's something about kind of sitting with that and that reflection. It could be that also the environment reinforces it, seeing things that remind them of the videos that they just saw. While that can't happen for a brochure group. And notably, the lack of change in stigma, which was a little surprising, might be that what we studied was self-stigma, and what it might have changed is maybe public stigma. So maybe people look at other people and don't judge them for their mental health difficulties after watching the video, but it takes a little bit more to not have those same thoughts about ourselves. Um, Also, I do want to note that it could be that we have a low sample size. So it may be that with more people, we do find a finding here, and that could be the case for the brochure group as well. So overall, the study found that faith-based video interventions have the potential to support mental health literacy and help-seeking attitudes of Black Christians. But further research is needed to understand how to strengthen and maintain this, and to see if this resonates for people when they're thinking about self-stigma. Thank you.